Good day, sir. I am Edmond M. Bigata, a BSN 2B student of Camarines Sur Polytechnic Colleges. In this video, I will be having a return demonstration about the essential intrapartum newborn care that covers from the 90 minutes to 6 hours after birth. Before we proceed with the procedure, let us first prepare the materials that we will be needing. For the eye care, we will be needing an erythromycin ointment. For the vitamin K administration, we will be needing 3 1cc syringes, as well as 1 milligram of aquamephyton, vitamin K, 0.5 ml of hepatitis B vaccine, 0.05 ml of BCG vaccine. We will also be needing a wet cotton ball, as well as a dry cotton ball. For cord care, we will be needing a gauze pad, a soap, and warm water. Okay, now let's proceed with the procedure by first performing proper hand hygiene. After the baby has detached from the mother, what are we going to do is to thoroughly examine the baby and place an identification band on the ankle. Primarily, there are two reasons on why we are putting identification band on the ankle and not on the wrist. Basically, newborns tend to move a lot, and when we put the identification band on the wrist, there is a tendency that they can hurt themselves and increase the risk of having injury. So putting the identification band on the ankle actually lessens the incidence of the baby on having head injury, as well as it also enables IV therapy and do not compromise IV fluids. Now, right after doing that, right after putting an identification band to the newborn's ankle, we will now be weighing the newborn and record the findings. So this is a newborn weighing scale. We have to remember that we have to weigh the newborn nude or no clothing at all. The normal birth weight of a newborn, according to Pillitary, is from 24.5 to 34.5 kilograms. We have also to make this consideration that 5% to 10% of newborn, 5% to 10% of newborn lose 5 to 10% of their weight after birth due to diuresis. Okay? Now, right after we do that preliminary procedure, we are now going to explain the mother the procedure that we are going to examine the baby for any birth injuries, malformations, and determine whether the baby needs extra treatment or early referral. So we have to start with the chest. On the chest area, the baby should breathe with ease. If we notice that the baby have grunting, chest indrawing, that the baby is suffering from tachypnea or bradypnea, it may be an early indication of respiratory distress. And then we have to check for the baby's first temperature. Ideally, we have to check the temperature on the axillary area. And the range of the baby's temperature should be from 36.5 to 37.5 degrees Celsius. We also have to check for the eyes and observe for any redness, swelling, or pus drainage. We also observe for the umbilical stump and observe for any oozing blood. Okay? And right after that, we are now going to check for the abdominal area. We are going to check for the abdominal distension. Now, if we felt that the abdominal area of the newborn is swollen and hard, it may be an indication that the baby is suffering from neonatal sepsis, or there is an excessive accumulation of fluid or gas in the intestinal lumen. After we perform the After we check for abdominal distension, we are now going to assess the head, the trunk, and the extremities for any abnormality. So if we are going to assess the head, normal findings would be this caput succedaneum, or the swelling of the scalp, as well as the cephalohematoma. This kind of finding actually results from the trauma coming from the delivery, and we have to assure the mother that will these manifestations will be gone after few weeks after birth. Okay, and if we are going to check the buttocks of the newborn, there is a bruise, otherwise known as the Mongolian spot, which is also a normal finding. What abnormal is if we see any abnormality with the position of the legs, such as talipes or clubfoot. This kind of abnormal positioning occurs when the baby had been delivered in a breech presentation. Okay? We need also to check the arm for any asymmetrical movement, asymmetrical arm movement, and we also have to check if there is no arm movement at all. We have to check that. And we have to look for any other malformations, such as what I've mentioned earlier, clubfoot or the talipes. If there is an open wound in the head, neck part, or in any other part of the body, and we also have to check for the patency of the anal opening. Okay. Now, if we notice that the newborn have a open wound, we have to immediately dress that up with a sterile gauze, keep warm, and then refer. Now, if there is an abdominal malformation, under the doctor of the attending physician, we can pass a nasogastric tube that will serve as a function for feeding as well as for excretion. Now we have to observe for any injuries of the baby. But how are we going to observe for injuries if there is swelling, of course, and if we touch certain part of the body, the baby cries. So crying is an indication that the patient is really in pain. If we notice this kind of abnormalities or malformation, we have to immediately refer the baby to a physician or for a doctor that specializes on that kind of abnormality. And we have to tell the mother regarding our findings. Okay, so after performing physical assessment, we are now going to perform eye care. So what are we going to use is, assuming that this is the erythromycin ointment. So this ointment actually helps for the prevention of the ophthalmia neotarum, otherwise known as the inflammation of the conjunctiva. So how are we going to administer this ointment? First is that we have to position the baby in a supine position, and using our thumb and index finger, we will be gently opening the baby's eyes, and then administer the ointment on the lower eyelid only, starting from the inner canthus going to the outer canthus. How are we going to spread the medication all throughout the eye? Well, we have to do a opening and closing motion gently in order to spread the ointment all throughout the eye. Next is that we have to do the same on the other side of the eye. Starting, open it gently using the thumb and index finger. Administer from the inner canthus going to outer canthus, and do an opening and closing motion. Okay, and then discard the ointment. Now we are going to administer vitamin K. So we have first to tell the mother what are we going to administer. We have to tell her that we are going to administer vitamin K. Vitamin K is very essential for the prevention of neonatal hemorrhage, since vitamin K is not yet fully developed, is not yet synthesized in the GI tract of the newborn. We can administer vitamin K in order to synthesize the vitamin K production in the newborn. We are also going to administer two vaccines, the hepatitis B, which is used in prevention for the hepatitis B, and as well as BCG, or the Basil Calmette Green, for the prevention of tuberculosis. So how are we going to administer this medication? So first is that we are going to withdraw 1 ml of vitamin K from the ampule. We are going to administer this medication intramuscularly into the vastus lateralis. We are going to use intramuscular injection, thereby we have to position the syringe at a 90-degree angle. So the vastus lateralis is in this part, and we have first to pinch the skin, inject at a 90-degree angle, aspirate. We have to aspirate in order for us to know that we've really hit the muscle and not a blood vessel. So if there is a blood upon aspiration, we have to stop administration. But if there is no blood upon aspiration, we have to go on with the administration of the medication. We have to administer it slowly and gently. Then put a cotton ball. And then discard the needle. We have to remember that if we've injected vitamin K on the right side, we need to inject the hepatitis B vaccine on the left side, or vice versa. We should never inject two medication on the same side. So doing the same procedure, we are going to withdraw first 0.5 ml of hepatitis B vaccine. We have first to clean the area, and then administer hepatitis B vaccine on the vastus lateralis intramuscularly, also at 90-degree angle. We have to pinch it first, and then aspirate. If there is no blood, we have to go on with the administration. And then discard the syringe. Now we are going to administer 0.05 ml of the BCG vaccine. We are going to administer it on the right side, specifically on the deltoid area. Since we are doing this intradermally, we have to position the syringe at 15 to 25-degree angle. So right after administration, a wheal should be formed. We have to tell the mother regarding what to expect, what would be the side effects of this vaccine. There will be local soreness at an infection site, at the injection site, or there is an abscess on there is a formation of a deep abscess, specifically when we administer the BCG vaccine. Now right after administration, before we leave the mother and the newborn, we have to make sure that there is no excessive bleeding on the injection site, okay? And then now we have to proceed with the core care. So assuming that we've already put a diaper on a patient, so we have to make sure that we have to fold the upper part of the diaper and make sure not to cover the stump. So using warm water and a sterile gauze, we have first to clean the base of the umbilical stump using a circular motion. We only need to use one sterile glove per movement, and then we are going to discard it. we will be using another, and then we clean the whole length of the umbilical stump by doing an upward motion, and then we discard it. Another. We have to clean for a foreign blood or clots or any other pus in the umbilical stump. We also have to check whether there isn't oozing blood. And if we've noticed any abnormalities with the umbilical stump, we have to of course refer the infant in into a physician. And then right after we do that procedure, we bring the infant back to his or her mother. We discard the needed materials and we perform hand hygiene. So that's how we do the EINC from 90 minutes to 6 hours after birth. Thank you.